Every parent wants to have a healthy pregnancy and healthy baby. That is our goal as we provide your care. About 3 to 5% of babies are born with birth defects. Some cause serious health problems and even death. Other defects can lead to lifelong problems. There are ways to find out whether your baby is at risk for some birth defects. Knowing there's a low risk can be a great comfort during your pregnancy. If your baby is at risk, your provider will give you and your baby the best care possible. Knowing your baby has a birth defect makes it possible to learn more about it before you give birth. Some parents may decide to have an abortion when their baby is found to have a birth defect. One of the tools we use is your family history. Your nurse or genetics counselor will review both your mother's and father's family history for signs of increased risk for certain birth defects. The family history of your baby's father will also be reviewed. A second tool is ultrasound. Ultrasound is used to look for structural abnormalities of the baby and see if its growth is normal. Ultrasounds might be done early in pregnancy to confirm dating, and at about 20 weeks to look for signs of abnormal development. Blood tests are a third tool. These are used to measure the chances your baby may have a chromosome condition such as Down syndrome, trisomy 13, or trisomy 18. 3 screening tests are offered at Gundersen and usually covered by insurance. Their timing and accuracy are somewhat different, but all have been used for many years. If you choose to have screening, only one of the blood test options will be done during your pregnancy. If a screening test is positive, more tests will be needed. The first trimester screen is done between 11 and 14 weeks. It combines an ultrasound with a finger prick blood test. This test detects 95% of babies that have Down syndrome. About 90% of babies that have trisomy 13 or 18 are found. The second is a single blood test done between 15 and 20 weeks. It detects 80% of babies that have one of these chromosome abnormalities. This is called the second trimester screen. The third test is called the serum integrated screen. For this test, a blood sample is obtained between 10 and 14 weeks and a second blood sample between 15 and 20 weeks. This test detects about 90% of babies that have Down syndrome and 85% of babies with trisomy 13 or 18. The serum integrated screen is sometimes used when ultrasound information is not obtained for the first trimester screen. Cell-free DNA is a newer, more accurate test that can be done as early as 9 weeks. It detects 99% of babies with Down syndrome, 97% of babies with trisomy 18, and 94% of those with trisomy 13. Most insurance will cover this test for women who are 35 or older or who have had a previous child with one of these chromosome conditions. You may also ask about carrier testing. This is testing for genetic disorders in which a gene change must be inherited from both parents. Carrier testing identifies when there is a risk to have an affected child because both parents are carriers. Individuals can be carriers even though there is no family history of the disorder. Carrier testing can be done for a single disorder, such as cystic fibrosis, or for several disorders. Insurance sometimes requires prior authorization to have carrier testing. We usually complete carrier testing on the mother and then test her partner if she is found to be a carrier. Your nurse or genetics counselor can provide more detailed information and answer questions about any of these tests.